So in this video we're going to watch the different markings for the hyoid bone and the vertebrae. So this is the hyoid bone. This bone is located here in the neck and around this level, and this bone has a horseshoe shape. This bone is the only unarticulated bone in our body, and it has a couple of pointed projections that are called the greater horns, and it has this anterior region that is called the body. Now this bone, since it's only held into our body by ligaments and muscles, it plays an important role in forensics. When someone gets slashed in their neck to be slaughtered, this usually pops out because it's not held by strong ligaments into our body. And this one can break also when someone is strangulated, because you apply a lot of force, and if you see, this bone is very thin. This is just to differentiate between when someone is strangled and someone commits suicide. So when someone hangs itself, usually the rope tends to slide over the body of the hyoid, and it doesn't break. But when someone is strangled, the force that they apply, it breaks the body of the hyoid bone. Now for the vertebrae, we're going to see first the general portions of the common vertebrae, and then we will see the specific features or markings for each of these vertebrae. So this is the typical vertebrae. So the typical vertebrae has an orientation with the body, which is this that goes anteriorly, and this part, this pointed part, which is called the spinous process, faces posteriorly and inferiorly. So this will be inferior, this is superior, this is anterior, and this is posterior. Now if I rotate it, I can see the sides. So this will be lateral. Now, so this again, this is the body, this is the spinous process, and on the sides we have the transverse processes. And in between the body and the spinous process, we have the vertebral arch, which is this. And this hole is called the vertebral foramen. Through here, the spinal cord fits into. And superiorly, we have the superior articular processes, and then inferiorly, we have the inferior articular processes. And this hole that you see here is called the intervertebral foramen, because when you have a joint articulation between different vertebrae at the superior and inferior level, you form a hole through which the spinal nerves that exit the spinal cord exits. Okay, and then the part of the vertebral arch that connects the transverse process to the body is called the lamina, and then the region that connects the transverse process to the spinous process is called the pedicle. So this is the features or markings for any vertebrae, with the exception of the first cervical vertebrae and the second. And also for, it doesn't apply for the coccygeal. So this is the atlas, the first cervical vertebrae. So within the atlas, instead of a body, this is the only vertebrae that it doesn't have body, we have lateral masses. So these lateral masses, they have a concavity that it is very pronounced, that faces superiorly. And this concavity has a complementary shape that fits into the occipital condyles, which is convex. So if you see, they fit, and then they allow us to knot like this. Now, this part in between the lateral masses that is anterior, this is the anterior arch, and this long part in between the lateral masses that is posterior, this will be the posterior arch. And on the sides of the lateral masses, we have these processes, which are called the transverse processes. And we have the transverse foramina, which is part of the cervical vertebrae. Cervical vertebrae has transverse foramina, through which the vertebral artery goes into our brain and provides blood supply to the posterior portion of our brain. And then in the anterior arch, internally, within the vertebral foramen, which is this, we have a smooth surface that it allows the articulation of the axis, which is the second cervical vertebrae, or C2. So the axis has this pointed projection that faces superiorly. This is the dens or odontoid process. So this odontoid process fits into this articular facet for the axis, or the dens of the axis. So when you put them together like this, you can rotate the axis over the atlas, or the atlas over the axis, so you can say no, or you can do lateral rotation. So this is the facet for the dens. And this dens is held into place by atlantoaxial ligament. So this is the atlantoaxial joint. And this dens, it's supposed to be kept into place. So this is a very fragile portion of our axis that sometimes during whiplash accidents, or when someone hits their head, this one can break, and then it can go against the spinal cord, which runs in here. And then depending on the damage or the extent of the damage into the spinal cord, the person can become paralyzed from neck down, as it happened to Christopher Reeve, the actor who did one of the Superman movies, or the person even can die. Okay, so then this dens is important. So then in the lateral masses inferiorly of the atlas, we have also a concavity, but it is not as pronounced as the superior portion. And this concavity fits into these lateral masses of the axis. So you can have this rotation. Okay, so then again, this is C2 or axis, and then this is the dens or odontoid process. These are the lateral masses. This is the body. This is the transverse process, and if you see this hole, since it's a cervical vertebrae, it's supposed to have these holes or these foramina in the transverse process. So this is the transverse foramina, and then we have the arch, and we have the spinous process and the vertebral foramen. So this is C2. Now let's look at the cervical vertebrae. So cervical vertebrae, it has the smallest body of all the vertebrae, and it has kind of a flat vertebral foramen, and it has short transverse processes, it has short spinous process, and the spinous process is almost horizontal, and sometimes the spinous process is split. When it's split, it's called bifid spinous process. And of course, in the transverse process, which are the lateral projections, you have the transverse foramina. Vertebral artery, again, the vertebral artery goes from the neck into the brain. And this will be superior articular facets and inferior articular facets, and this will be the intervertebral foramina. So this is the cervical. Now, this is the thoracic vertebrae. So it has a medium-sized body. It has a rounded vertebral foramen. It has pointed superior spinous processes, and it has a short spinous process that faces inferiorly, like at an angle. It has medium-sized pronounced intervertebral foramina, and these will be the transverse processes. Now, these vertebrae are the only ones that articulate with ribs. And because it has to have a feature to connect to the ribs, it has it. So it has the transverse costal fossa in here, which is a smooth part of the transverse process, and it has the costal fossas here on the body, in the edge of the body, superiorly and inferiorly. So then this is the rib, and the rib has a head, and it has a neck, and it has an angle, or a tubercle. So within this region, we have the connection in the head for the body of the vertebrae. So if you see here, the head of the rib connects to the body of the vertebrae, and the tubercle connects to the transverse process in the transverse costal fossa. So basically that's how it will look. So then these will be the features of the thoracic vertebrae. Now for the lumbar. The lumbar, they have the most massive body. So as you go from cervical vertebrae to thoracic to lumbar, the size of the body increases. Why? Because this is actually the part of the vertebrae, the body, that helps to carry your weight. Okay, so since the cervical vertebrae, they only have to carry the weight of our head, they have light body, and then the thoracic ones, they carry not only the weight of the head, but also the thorax, so they have a medium-sized body. And this one, they have to carry the weight of the head, the thorax, and the abdomen. So that's why these ones have a heavier body, or a thicker body, or much stronger. So it has then the most massive body. It has kind of a triangular shape, transverse foramen. It has short transverse processes, short spinous process that ends in a blunt end, and it has kind of low superior spinous processes and pointed inferior spinous processes, and then it has a very thick intervertebral foramina. Why is this? Well, because the spinal nerves that exit the spinal cord, they have to provide innervation or give sensation or movement to muscles of our region, or to a region of our body. It provides sensation to a region of our body. Since our legs are much bigger than our arms, the spinal nerves of the lumbar area are thicker. So that's why we have a bigger intervertebral foramina. Okay, so I'm going to put them all three together so you can see the differences. So this one, lightest body with transverse foramina, short spinous process, cervical. Medium-sized body with transverse and costal fossas in here in the body. This will be thoracic. And big body, short transverse processes, short spinous process. This will be the lumbar. Now the vertebrae then that has special names will be atlas, C1, axis, C2, and the 7th cervical vertebrae, the last cervical vertebrae, which is C7. It has the name of vertebra prominens because the transverse process, the spinous process of this vertebrae is the longest one. And that's kind of a reference point that many people use to start counting the vertebrae. Now, if you touch your back, you will be able to feel then at the base of your neck your vertebra prominens, and then from there you can start going down, touching your different spinous processes, and then from there you can say, okay, this is T1, T2, T2, T3, and so on and so forth. Okay, now let's look at fused vertebrae. which are located within the sacrum and the coccyx. So this is the sacrum. It has kind of a triangular shape with the base facing superiorly toward the lumbar area, and then the apex facing inferiorly, connecting to the coccyx. So this is the anterior view of the sacrum. This is the posterior view. This is superior, this is inferior, and this is lateral. So in the anterior view, you can see the place where the bodies get fused. So this is the first sacral, second, third, fourth, and fifth. So we have 5 vertebrae that get fused, and this is called the transverse ridges, anterior transverse ridges. So that's where you have the fusion of the vertebrae, and these holes in here are called the anterior sacral foramina. So sacral nerves exits through here, the anterior sacral nerves, which are going to provide innervation sensation or movement to different pelvic organs or structures. And then this edge that it's better seen in the lateral view, this is called the promontory, because this is the actual part of the body, which is this, of any vertebrae that faces more anteriorly. So this is promontory, okay, the sacral promontory. And then in here, on the sides of the body of S1 or the sacral one, we have the ala or wing, okay, which is at some point this part as well. So all of this part that you see here, this is the ala or wing. And this will be the superior transverse processes. And then on the sides of the ala, we have the auricular surface. Auricular like auricle, like ear. So this auricular surface articulates with the coxal bone. So basically it does this, articulate just like this. Okay, so the iliac part of the coxal bone articulates with the auricular surface of the ala. Now, if you see it posteriorly, you can see some areas where the fusion of the different parts of the vertebrae has happened. So in the case of this mid portion that you see here, this is called the sacral eminence, and this part is where the fusion of the spinous processes happens. And in here, we have the fusion laterally of the transverse processes. So this will be at some point also called medial sacral ridge, and this will be called lateral sacral ridge. And in between the medial and the lateral sacral ridge, we have posterior sacral foramina, which is the continuation of this, as you can see here. And then the posterior sacral nerves exit posteriorly to innervate different structures like the gluteal muscles, etc. So several sacral nerves exit through here. They form nerves specifically that innervate different structures. And it is not seen pretty well. There are some sacral models or models of the sacrum where you can detach this ridge, but in here we have a hole that it is called the sacral canal. And the sacral canal narrows down as it goes toward the coccyx and ends in a narrow hole in here that is called the sacral hiatus. So we have the flow then of a spinal, cerebrospinal fluid through here, through the sacral canal and the sacral hiatus. And then finally we have this coccyx, which is made out of 3 to 4 coccygeal vertebrae fused, and this will be the tip of the coccyx that sometimes when people fall down in their butt, they break the tip of the coccyx. It's painful, but it can rejoin again. All you do is just prevent the person from moving a lot. Okay, so I think that's all that I have then for the spinal column, the markings in the articulated spinal column. Bye-bye.